Hello everyone, this is NainaMD. Welcome to my show right here in Beverly Hills, Fusion of Science and Beauty. And today, as always, is the start of the new year for me, and I'm going to have a fabulous, fabulous guest lineup, just like I did last year. But today, I've got a guest who is phenomenal. He is a very well-renowned plastic surgeon, and he's double board certified in plastics and ENT, which is ears, nose, and throat. So I want to welcome Dr. Kamar Dhir, and he is going to talk to us about amazing eye rejuvenation. What's the latest and greatest? Thank you so much for coming on the show, Dr. Dhir.
Thanks for having me. I really appreciate it.
You know, you have been, everyone knows about you around here at Beverly Hills. And I think what I want the audience to get from the segment today is that so much has come up with eye rejuvenation, right? We started off years and years ago with just sort of like fixing a droopy eyelid or a blepharoplasty, which is getting rid of the excess skin around the eyes as we age.
Correct.
And I just want you to just explain to the audience there's something known as the endoscopic brow lift. There are procedures, what is the latest, greatest in eye rejuvenation? That first, let's start with what women can do, and then what men can do, right?
Course.
Women first.
Women always first, definitely.
Absolutely.
Well, I think we've come a long way with rejuvenation in general, and I know that you practice anti-aging medicine, and I think the terms nowadays that we hear are facial rejuvenation, anti-aging, facial plastic surgery, youthfulness, but I think all these terms are really, I'm gravitating towards the anti-aging movement because there's a lot of science behind it, and I think that makes it really important for patients.
Thank you so much, because this has really been my passion of the whole idea and the concept of the show. Anti-aging or regenerative medicine has been very, very controversial.
Correct.
And I agree. When we started off as anti-aging, that term, yes, it had a lot of crap because nobody knew really what was going on. There was hormones, there's all this interplay, but it has really become so evidence-based, especially when we bring functional medicine into it. And I really want to tell you is I so appreciate you saying that, because when I represented a multi-billion-dollar company, which was Olay, Procter & Gamble, Olay, they considered me as the anti-aging expert. So it brought a lot of credibility, and that's what we try to do.
Correct.
Anti-aging is definitely a term. I hate to say it's a sort of like a negative, anti-aging, but we really are now mixing it with regenerative medicine. Right?
And even the term anti-aging, we can even dissect it further and further, and I can tell my opinions on it. I'm only bringing up anti-aging as a movement. The reason I love it, or I feel like I'm a proponent or a champion of it for my patients, is that I think that science, having options, understanding the aging process will help all of us, patients and physicians and treatment professionals. What's the best for the patient? Absolutely. And anti-aging, we don't want to not age. I never feel that I want to tell a patient we want to go back to a better time or when we're younger. Sure, we have all great memories, but we are where we are, and we've come a long way in maturity. So is there a way to look refreshed, youthful, and look our best so we feel confident? That's where it really comes down to. And so with that said, I think anti-aging is a great place to start because it's science behind it. Just because you have a cream that makes you look younger, well, what's the science behind it? So around the eyes, I think the most important thing is first to say is that when we look in the mirror and we see a reflection of ourselves, we judge ourselves of how we look, how we feel, how young we are, and that's also the way we present ourselves to the world. And so we do see things that happen in the face, and so the latest and greatest should be discussed only when we know what's happening around the eyes.
You're absolutely right.
And I think in aging, there's only two things that we all are fighting. One is volume loss, meaning that our skin is getting thinner.
Meaning, is that when also the skin's getting thinner, and then all the volume loss underneath the eyes, right? A lot of the women, they're just like sunken. You feel very tired and so forth, right?
Yeah, and that's the first thing that a lot of women come and say is that I've had a baby, I'm in my mid-30s, I feel like I'm not refreshed, I haven't gotten a good sleep. And a lot of that is just because of volume loss, basic volume loss, skin gets thinner, and then also the facial fat around certain portions of the face start to regress. And so that's one thing, and it could be hormone changes, it could be sun damage, it could be smoking history, it could be alcohol, unhealthy lifestyle, genetics, if I didn't bring that up yet.
How do you fix that?
So if it's simple volume loss, volume and restoration, well, number one is you can get hormone therapy, you can do, you want to get a fillers. And I think in the cosmetic world, once you have a good medical background, that your thyroid is okay, there's all these things we can discuss. But volume loss simply is return volume where it needs to go.
What
And the
about
best option is fillers.
So fillers is good. How about the newest, what do you do, fat transfer?
Yep. There's fillers, which are synthetically made volume, which you can inject around the eyes.
Which is most of the hyaluronic acid and so forth, right? Things that I think common ones people always read about is the Restylane, Juvederm,
correct.
Right? Bellator is sort of coming up there now. So.
Yep. And I think we've been bombarded in the media with mostly hyaluronic acids because they are reversible. They're temporary and they're safe, and so those can be injected.
I think particularly around the eye area, I agree with you. I think that's a very safe option for women.
And patients who need a little bit more volume, there are other options around the eyes. We could do fat transfer, which would take fat from another part of the body and then
How
inject
long does that
an
last?
area.
I know a lot of times people ask me that question when I refer patients to you and so forth. People always ask me, how long is that going to last?
So specifically fat transfer. Fat transfer is taking fat from your body and injecting to your face. And you want that to completely take. But over the year, a certain percentage regresses or resorbs, meaning it does not take. However, anything that does take is permanent.
So it's good for a couple of years at least.
Well, it's permanent in the sense of whatever it takes.
Yeah, exactly,
so you may have to get a secondary procedure, but the point is whatever it does take, it is a long-term option.
And we know that the fat cells have so much stem cells, right?
Correct.
And that's a whole, and I think the other misnomer is like people just think, oh, it's just this yellow fat that's just being put in, and that's not.
No.
You process it, there's a whole finesse to it, this process is all FDA, approved and all of that procedure. But its main thing is that you know how you're getting all of those so to speak, all the toxins and everything are being all separated. You're getting really clean fat,
correct.
And that fat has the stem cells, correct?
Correct. The procedures are getting very tight, and we're getting better. We're improving them, where we're getting more stem cells. More stem cells means more take of the fat, and so if 30% of it lives or 60%, we hope to get it higher and higher. It's for the longer term result, and that is for a fat transfer specifically. Fillers are different. They go from 6 months, 9 months to a year.
And that's where we get into. Okay, so if you have these viable stem cells, right? And I often do talks on this. It's like, okay, if you have the viable from the inside, which is what I love as well, is how do we create an environment for the stem cells to survive?
Correct.
So all of that is the hormones, the nutrients, all of those things. We have to make sure that the body, the lifestyle.
Right.
So I think a lot of times when people say, well, how long is it going to last? Depends on their lifestyle too.
Right. I think science meets art. You can only put the fat where it needs to go, and you do it correctly, artistically. But if the patient itself is exercising, more blood flow,
I've seen some of the amazing
healthy
pictures. You did not bring them with you.
No, I didn't.
But they're amazing pictures. I mean, the audience should really. I hope to get a sense of appreciation if they go to your website. I hope you've got some before and after pictures, but I've actually seen. I mean, you do amazing work. Really,
thank you so much.
I've especially seen it. The eyes. I mean, I literally. There's a tired-looking eye, so to speak. The whole facial appearance is so tired. After the procedure, it's just like the woman has it's just the glow, and it's just like she's got a sparkle in her eye back.
Correct.
It's an amazing work.
And that patient was, healthy lifestyle, going through the anti-aging process. And then also we'd return volume where it needs to go. And then gravity was a second part of aging. And the brow lift, which you brought up.
Tell me about that. What is the endoscopic? Is that the latest? Is the endoscopic brow lift?
Endoscopic brow lift is the latest in the sense it's been around for a while now. The brow lift itself is very antiquated.
In other words, it's sort of like the gold standard, like it's a bangs for the...
Every patient should be customized. It is the latest and greatest, and it's a wonderful option. I offer it to most patients. However, it's customized.
Is it scarred?
It's a great procedure where all the scars are hidden in the hairline. And you go under, and we lift the brow. And many women will see this as they age, is that they can't get the eyeshadow on their eye.
Exactly.
And they do this instinctually in the mirror. And it's because the brow falls as we age.
Right.
And by lifting the brow gently and to open up the skin that hangs to bring up, it's a procedure that doesn't take away skin, but actually allows the eyeshadow to be placed up. And when it's done correctly, it should not have a surprised look, which is something that people talk about.
And you make it look very natural. And I think that's really one of the things, at least, a lot of the slap patients that I get, and at least in Hollywood, I think the endoscopic brow lift is amazing because of the TV appearances, for just just public and so forth, speaking, and anyone who does any sort of public careers. Many of them have gone for the endoscopic brow lift.
Correct.
It just gives such a sort of a professional, a very youthful looking appearance.
Yep. And a healthy person, a healthy patient has a good lifestyle with doing a brow lift really opens up and rejuvenates the eyes.
Third thing I want to ask you on that is, a lot of times people feel like they're losing volume behind the it's almost like the volume behind the eye socket.
Correct.
How's that? How is that corrected sometimes? Is it possible to do that? Because I've noticed we can do the fillers, right? Fat transfers, fabulous endoscopic brow lift, but sometimes it's behind the eye socket. They're actually getting, it almost looks like where the eye's sort of getting retracted.
Correct.
Right?
Again,
can you explain that?
Yeah. Again, it's volume loss and lifestyle. As you have
Yeah.
volume loss, so returning volume in the best way.
Right.
So fillers, fat transfer, getting a brow lift, either endoscopic like we've discussed, or even small incisions in the brow
Yeah.
line to lift
Yeah.
it up. But in general, I also tell patients to go see a medical professional that they trust so they can look into their allergies, chronic sinusitis that can cause congestion or causing changes around the eye for aging.
Yes.
See a doctor as yourself for anti-aging to make sure the hormone levels are good because you do age at a different
Yes.
rate. So I think there's a little bit of science where you need a medical professional to help out with making sure the health is top notch,
Yeah.
and then a cosmetic and aesthetic surgeon to add volume such as a filler or fat transfer.
Yeah. And you know, it's I'm going to bring you on another segment because we're going to get into a lot of things about, like, you know, how we topical things that we can use, right? Topical ingredients, and what you as a plastic surgeon would recommend.
Definitely.
That's really what I want your a key take on. How do people look you up? How do they, like, you know, sort of discover you? Give me your website or...
Sure. Please come visit us anytime at www.drdheer.com, which is DR, D as in David, HIR.com. I have a lot of educational, academic articles there for people to read more about the science. There's a lot of pictures to see for the aesthetic portion. And so come visit us anytime.
You're in the Golden Triangle of Beverly Hills.
Yeah, we're off of Camden Drive, right
Yes,
in Beverly
you
Hills,
are,
California. We have beautiful views at our office for patients to come and enjoy, so come visit us in
I
Los
know your
Angeles.
office is gorgeous, by the way. But thank you so much for coming on to my show,
Thanks for having
and definitely you're coming back on another show.
Absolutely, it's a promise. I've enjoyed myself. Thank you.
All right, great. Guys, this is NainaMD, Beverly Hills, Fusion of Science and Beauty, amazing guest, and I'll be right back with my next guest.